Hello, prostate cancer warriors. My name is Al, and welcome to this video on my experience with CyberKnife for treatment of prostate cancer. What follows is a brief history leading up to my diagnosis and why I chose CyberKnife. Here are my PSA results between January 2014 and December 2018. Dotted green line represents lower limits of normal, where the solid green line represents upper limits of normal. Between July 2017 and December 2018, a 1.5 year period of time, my PSA doubled from 4.3 up to 8.24. So at this time, it was determined that a biopsy was in order. So my biopsy was done on January 18th, 2019. 12 core samples were taken, and cancer was found in 2 cores in the left apex and 1 core in the left mid region. My Gleason score was a 7, 3 plus 4, with 10% of the cancer being a 4 and 90% of the cancer being a 3. My DRE was a T1C, and according to the World Health Organization, my grade group was a 2. The World Health Organization has 5 grade groups, all based on the Gleason score. The range is from 1, least aggressive, to 5, most aggressive. I also had no clinical symptoms at all. So when I got my diagnosis, I was a little bit surprised. How could this be? I've always been a pretty healthy guy with a healthy lifestyle. I exercise 4 to 5 times per week. I don't smoke. I drink in moderation, and I eat well. My blood work has always been very good with normal cholesterol levels. It didn't seem possible that I could come down with prostate cancer. At the advice of a good friend, I took a deep breath, slowed things down, and began gathering information on prostate cancer. Over the next 2 months, I surfed the internet for information on prostate cancer and treatment options. I read Dr. Patrick Walsh's Guide to Surviving Prostate Cancer. I met with the radiation oncologist and urologist where my cancer and treatment options were discussed. And I talked to patients who chose either surgery or radiation and got their firsthand experiences. I also found 2 great websites that helped a lot. At nccn.org, National Comprehensive Cancer Network, you can download a 102-page booklet on patient guidelines for prostate cancer. It's a great resource written in layman's terms, and the goal of this booklet is to help men get the best prostate cancer treatment. This booklet presents which tests and treatments are recommended by experts in prostate cancer. The NCCN is a nonprofit alliance of 28 of the world's leading cancer centers, and experts from NCCN have written treatment guidelines for prostate cancer doctors. I also found prostatecancerfree.org very helpful. Here you can compare success rates for the various treatment options available. Their primary goal, as stated in their mission statement, is to help people make better decisions about prostate cancer treatment. At Prostate Cancer Free, you have the opportunity to compare prostate cancer treatments within your risk group. The outcomes of over 100,000 patients across the last 15 years show which treatments were most effective. The charts show which treatments are more likely to leave patients prostate cancer free and for how many years. Prostate Cancer Free will help you make an informed decision, allowing you to select the treatment option that is best for you. Here is a sample graph comparing outcomes for surgery to external beam radiation therapy plus seeds plus ADT in a patient with high-risk prostate cancer from 2017. The horizontal axis is years following treatment, where the vertical axis is treatment success. In mid-March, I had a consult with a radiation oncologist, Dr. Robert Meyer, at the Swedish Radio Center in Seattle. He examined me and reviewed the different treatment options, pros and cons of each treatment, and side effects of all treatments. He then reviewed CyberKnife and the early positive clinical outcomes that were being reported. I left feeling very hopeful, encouraged, and confident that I may have found a great treatment option in CyberKnife. At this time, I was leaning towards CyberKnife, but needed to do more independent research on this treatment option. I also talked to a few patients who had CyberKnife to treat their prostate cancer, and they all raved about this treatment. It took care of their cancer with minimal side effects, thus giving them a continued high quality of life. So by early April, I made a decision to treat my prostate cancer with CyberKnife. I called the Swedish Radiosurgery Center and informed them of my decision. So what exactly is CyberKnife? CyberKnife is the world's first and only robotic radiosurgery system. It's radiation therapy that sounds like surgery, but isn't. And it's offering new hope for patients with low and intermediate risk localized prostate cancer. Although its name suggests scalpels, operating rooms, and recovery time, CyberKnife treatment involves no cutting, no pain, and no hospital stay. The CyberKnife system is a robot that delivers a unique form of stereotactic body radiation therapy, SBRT for short, also known as radiosurgery. It is the only radiation therapy technology that tracks tumor motion and automatically corrects the aim of the treatment beam when movement is detected. The CyberKnife radiosurgery system delivers radiation with sub-millimeter accuracy through the use of continual image guidance and robotic mobility. As a result, the radiation is directed to where it counts most, the prostate, and the radiation dose falls off steeply around a healthy tissue that surrounds the prostate. Studies are showing CyberKnife treatment produces exceptionally good PSA responses with a low incidence of side effects. This is a slide that shows mean PSA responses over 36 months for 35 patients treated with low and intermediate risk prostate cancer at the Seattle CyberKnife Center. Note 3 months after treatment, the PSA levels dropped to less than 2. At 12 months post-treatment, the PSA levels dropped to less than 1. And by 36 months post-treatment, PSA levels were near undetectable levels. There are 4 clinical patient benefits of the CyberKnife system. Number 1, advanced robotics. The CyberKnife system is a linear accelerator mounted to a robotic arm that is specifically designed to deliver stereotactic radiation from hundreds of different angles. Unlike other radiation devices, the CyberKnife robot is not fixed. It moves in multiple directions throughout multiple planes without interruption to precisely target the prostate. There is a significant departure from gantry-style systems traditionally limited to 7 to 9 radiation delivery angles. This means that the CyberKnife system can avoid healthy tissue and deliver a highly conformal and individualized treatment for the prostate. In other words, creating a prescription dose that conforms closely to the shape of the prostate gland while minimizing inclusion of the surrounding tissues based on your personal anatomy. Given this robotic maneuverability, less healthy tissue is affected, and higher doses targeting the process can be delivered exactly where it counts most. Number 2, compensates for prostate movement. The prostate gland can move unpredictably throughout the course of treatment. That makes the ability to track, detect, and correct for motion critically important. Unlike any other radiation treatment, the CyberKnife system continually tracks and automatically corrects for the movement of the prostate in real time. This enables the system to correct the beam direction so that it is focused on the prostate throughout the entire treatment. The robot constantly monitors and aligns the real-time location of the prostate to ensure any adjustments in the beam delivery match the prepared treatment plan, while automatically correcting for any movement during a treatment by relaying critical information to the system software. Safety mechanisms are in place to ensure that the beam of radiation is locked on to the intended target should your prostate move out of acceptable range. For example, if a gas bubble moving through the rectum or the bladder starts to fill during treatment, a system correction compensating for movements of the prostate automatically occurs. Number three, reduced treatment time. Compared to alternative methods that can take up to 8 to 9 weeks or 40 to 45 sessions of radiation therapy, an entire CyberKnife treatment plan can be completed in 4 to 5 sessions. Each treatment session is typically completed in 1 hour or less. The CyberKnife system is designed to treat with a higher per fraction dose given its superior accuracy. This substantially reduced treatment time frame is advantageous for busy men seeking the least amount of disruption to their daily lives. Number four, a non-invasive procedure. Aside from the placement of tiny gold markers called fiducials inside of the prostate, a pre-treatment procedure that assists the imaging system to more accurately target tumors, the CyberKnife system process is completely non-invasive. There's no cutting, anesthesia, or hospitalization required. The CyberKnife robot moves quietly around a patient who lies comfortably on the treatment table. The robot will move in nearly every direction to fully deliver the prescribed treatment dose. Here is a clinical study summary on the largest clinical studies to date supporting CyberKnife, SBRT for localized prostate cancer. This can be found on the Accuray website, www.accuray.com. They are studies done by Dr. Robert Meyer at the Swedish Radiosurgery Center in Seattle and Dr. Donald Fuller at the CyberKnife Center in San Diego. Both studies were published in late 2018. The first study was published by Dr. Robert Meyer at the Swedish Radio Center in Seattle. 309 patients were admitted into the study. 172 had low-risk prostate cancer, and 137 had intermediate-risk prostate cancer. 40 guy was delivered over 5 fractions. Cure rates at 5 years were 97.3% for low risk and 97.1% for intermediate risk prostate cancers, with toxicity rates comparing favorably to conventional radiotherapies. The second study was published by Dr. Donald Fuller in San Diego. This study included 259 patients, 112 had low-risk prostate cancer, and 147 had intermediate-risk prostate cancer. The cure rates at 5 years was 100% for low risk and 88.5% for intermediate risk prostate cancers. Toxicity rates compared favorably to conventional radiotherapies. Once I decided on CyberKnife, there was a 4-step process I went through. These 4 steps required close collaboration among the CyberKnife team, the patient, and their personal physician. The entire process has one goal: provide the very best treatment that will help the patient quickly return to an active lifestyle. Those steps are a consultation, planning, treatment, and follow-up visits. The consultation step had already been completed, so now we move to the second step in the process, which was planning. On May 10th, I had fiducial markers and space ore placed under conscious sedation. In preparation, I was given an antibiotic the evening before and morning of the procedure. Beginning at midnight the day before my procedure, I was not allowed to eat or drink anything, and I had to self-administer a Fleet's enema the day of my procedure. On May 16th, I had an MRI and a CAT scan. 24 hours prior to these scans, I had to be on a low-gas diet. I was not allowed to eat or drink anything 2 hours prior to my first scan. 1 to 2 hours prior to my first scan, I had to self-administer a Fleet's enema. During the CT scan, I had a urinary catheter placed through my penis into the bladder for a short time. This was to view the location of my urethra. Using the images and the CyberKnife system's treatment planning computer, the radiation oncologist will identify the tumor's exact size, shape, and location. And together with the medical physicist, will create a personalized treatment plan that will provide the desired radiation dose to the correct location while avoiding damage to the surrounding healthy tissue. The picture on the right shows my specific personalized treatment plan. After the consultation and planning steps, it's now time to receive the actual treatment. I was given 5 treatments over 5 different days, with each treatment lasting about 60 minutes. I had 2 treatments before the Memorial Day weekend on May 23rd and 24th, and then finished up with 3 treatments after the holiday weekend on May 28th, 29th, and 30th. While receiving treatment, I was on a low-gas diet. 1 to 2 hours prior to each treatment, I self-administered a Fleet's enema. When I had treatment in the morning, I refrained from eating breakfast. If treatments were in the afternoon, I could have a light lunch. Treatments were totally painless, and I found my time lying on the treatment table very relaxing. On the left, I'm shown at the Swedish Radiosurgery Center on May 23rd, 2019, about to receive my first CyberKnife treatment. Once treatment is completed, it's customary to ring the bell, so on the right, I'm shown clanging the gong 3 times on May 30th, 2019. Immediately upon completion of my 5 treatments, I received discharge instructions from the nurse practitioner. Most patients experience minimal side effects after CyberKnife treatment. Side effects may include fatigue, urinary, bowel, and sexual changes. Personally, I noticed a weaker urinary stream after the 4th treatment and was placed on the lowest dose of Flomax. 1.5 months later, I am still on Flomax and have done trials off of Flomax and expect to be off it by 3 months. I've experienced no increase in frequency, urgency, or burning. I did, however, notice some mild bowel changes. I noticed loose stools and some constipation, and a constant feeling of needing to have a bowel movement. After 2 weeks, these changes all resolved on their own. Finally, my sexual function has remained intact. There's been no problem obtaining an erection or having an orgasm. Orgasms now tend to be dry with little or no ejaculate. Once my 5 treatments were finished, I had a follow-up visit at 1 month to check how I was doing and see if I was experiencing any side effects. My next visits will be at 3 months, 6 months, and 12 months, where each time I will have a PSA blood test. In summary, I give CyberKnife a big thumbs up. Treatment was great. Compared to other radiation treatments that take 8 weeks or 40 total sessions, I was able to be treated in 5 sessions, with each treatment lasting about 1 hour. There was no pain or discomfort, and I was able to go about my normal daily activities without problems. At 1.5 months post-treatment, I have no urinary, bowel, or sexual issues at all. I'm very pleased with my treatment and believe CyberKnife took care of my cancer with minimal to no side effects resulting.